Audiology. Audiology, audire, to hear, and from Greek logia, is a branch of science that studies hearing, balance, and related disorders. Audiologists treat those with hearing loss and proactively prevent related damage by employing various testing strategies: behavioral hearing tests, autoacoustic emission measurements, and electrophysiologic tests. Audiologists aim to determine whether someone has normal sensitivity to sounds. If hearing loss is identified, audiologists determine which portions of hearing, high, middle, or low frequencies, are affected, to what degree, severity of loss, and where the lesion causing the hearing loss is found: outer ear, middle ear, inner ear, auditory nerve, and/or central nervous system. If an audiologist determines that a hearing loss or vestibular abnormality is present, they will provide recommendations for interventions or rehabilitation, hearing aids, cochlear implants, appropriate medical referrals. In addition to diagnosing audiologic and vestibular pathologies, audiologists can also specialize in rehabilitation of tinnitus, hyperacusis, misophonia, auditory processing disorders, cochlear implant use, and or hearing aid use. Audiologists can provide hearing health care from birth to end of life. Audiologist. An audiologist is a healthcare professional specializing in identifying, diagnosing, treating, and monitoring disorders of the auditory and vestibular systems. Audiologists are trained to diagnose, manage, and treat hearing tinnitus or balance problems. They dispense, manage, and rehabilitate hearing aids and assess candidacy for and map cochlear implants. They counsel families through a new diagnosis of hearing loss in infants, and help teaching, coping, and compensation skills to late deafened adults. They also help design and implement personal and industrial hearing safety programs, newborn hearing screening programs, school hearing screening programs, and provide special or custom fitted earplugs and other hearing protection devices to help prevent hearing loss. Audiologists are trained to evaluate peripheral vestibular disorders originating from pathologies of the vestibular portion of the inner ear. They also provide treatment for certain vestibular and balance disorders such as benign paroxysmal positional vertigo (BPPV). In addition, many audiologists work as auditory or acoustic scientists in a research capacity. Audiologists are trained in anatomy and physiology, hearing aids, cochlear implants, electrophysiology, acoustics, psychophysics and psychoacoustics, neurology, vestibular function and assessment, balance disorders, counseling and communication options, such as sign language. Audiologists may also run a neonatal hearing screening program, which has been made compulsory in many hospitals in US, UK, and India. An audiologist usually graduates with one of the following qualifications: Bachelor of Science, Master of Science, Audiology, Audi STI, PhD, or science degree, depending on the program and country attended. In 2018, a report by CareerCast found the occupation of audiologists to be the third least stressful job surveyed. History. The use of the terms audiology and audiologist in publications has been traced back only as far as 1946. The creator of the term remains unknown, but Berger identified possible originators as Mayer B.A. Scheer, William B. Hargrave, Stanley Nowak, Norman Canfield, or Raymond Carhart. In a biographical profile by Robert Galambos, Hallowell Davis is credited with coining the term in the 1940s, saying the then prevalent term auricular training sounded like a method of teaching people how to wiggle their ears. The first U.S. university course for audiologists was offered by Carhart and Northwestern University in 1946. Audiology was born of interdisciplinary collaboration. The substantial prevalence of hearing loss observed in the veteran population after World War II inspired the creation of the field as it is known today. The International Society of Audiology ISA was founded in 1952 to facilitate the knowledge, protection, and rehabilitation of human hearing, and to serve as an advocate for the profession and for the hearing impaired throughout the world. It promotes interactions among national societies, associations, and organizations that have similar missions. Through the organization of a biannual World Congresses, through the publication of the scientific peer-reviewed International Journal of Audiology, and by offering support to the World Health Organization's efforts towards addressing the needs of the hearing impaired and deaf community. Requirements Australia. In Australia, audiologists must hold the Master of Audiology, Master of Clinical Audiology, Master of Audiology Studies, or alternatively a bachelor's degree from overseas certified by the VITA SSESS. Although audiologists in Australia are not required to be a member of any professional body, audiology graduates can undergo a clinical training program or internship leading to accreditation with Audiology Australia, AUD-A, or the Australian College of Audiology, ACAUD, which involves supervised practice and professional development and typically lasts 1 year. To provide rehabilitative services to eligible pensioners, war veterans, and children and young adults under the age of 26 as part of the Hearing Services Program. An audiologist must hold a qualified practitioner QP number, which can be sought by first obtaining accreditation. Brazil. In Brazil, audiology training is part of speech pathology and audiology undergraduate 4 year courses. The University of Sao Paulo was the first university to offer a bachelor's degree, and it started operations in 1977. At the federal level, the recognition of the educational programs and the professional of speech pathologists and audiologists took place on December 9, 1981, signed by President João Figueiredo, Law Number 6965. The terms audiology and audiologist can be tracked in Brazilian publications since 1946. The work of audiologists in Brazil was described in 2007. Canada. In Canada, a Master of Science MSc is the minimum requirement to practice audiology in the country. The profession is regulated in New Brunswick, Quebec, Ontario, Manitoba, Saskatchewan, Alberta, and British Columbia, where it is illegal to practice without being registered as a full member in the appropriate provincial regulatory body. Bangladesh, a Bachelor of Science, Hons in Audiology and Speech Language Pathology is required. In India, to practice audiology, professionals need to have either a bachelor's degree or a master's degree in audiology and be registered with Rehabilitation Council of India (RCI). Malaysia. Three Malaysian educational institutions offer degrees in audiology. United Kingdom. There are currently 5 routes to becoming a registered audiologist: FDSC in Hearing Aid Audiology, BSc in Audiology, MSc in Audiology, Fast Track Conversion, Diploma for those with a Bachelor of Science in another relevant science subject, available at Southampton, Manchester, UCL, London, and Edinburgh. BSc Hons in Clinical Physiology, Audiology, available at Glasgow Caledonian University. All applicants must be NHS employees. United States. In the United States, audiologists are regulated by state licensure or registration in all 50 states and the District of Columbia. Starting in 2007, the Doctor of Audiology AUD became the entry level degree for clinical practice for some states, with most states expected to follow this requirement very soon, as there are no longer any professional programs in audiology which offer the master's degree. Minimum requirements for the AUD degree include the minimum of 75 semester hours of post-baccalaureate study, meeting prescribed competencies, passing a national exam offered by Praxis series of the Educational Testing Service, and practicum experience that is equivalent to a minimum of 12 months of full-time. Supervised experience. Most states have continuing education renewal requirements that must be met to stay licensed. Audiologists can also earn a certificate from the American Speech Language Hearing Association or seek board certification through the American Board of Audiology, ABA. Currently, there are over 70 AUD programs in the United States. In the past, audiologists have typically held a master's degree and the appropriate healthcare license. However, in the 1990s, the profession began to transition to a doctoral level as a minimum requirement in the United States. Starting in 2007, audiologists were required to receive a doctoral degree, AUD or PhD, in audiology from an accredited university graduate or professional program before practicing. All states require licensing. An audiologist may also carry national board certification from the American Board of Audiology or a certificate of clinical competence in audiology, CCCA, from the American Speech Language Hearing Association. Pakistan. In Pakistan, a master's or doctoral degree in audiology is required to practice this profession. This medical degree must come from a recognized institute, most of which are government. Otherwise, the person didn't get the license to practice audiology. Pakistan Medical and Dental Council (PMDC) issues the practicing license to all the medical students. Besides these, the person who provides the medical instruments to these doctors should also have the certificate of accreditation issued by the Pakistan National Accreditation Council (PNAC). Portugal. The exercise of audiologist profession in Portugal necessarily implied the qualifications degree in audiology or legally equivalent as defined in Decree Law 320/99 of August 11, Article 4. South Africa. In South Africa, there are currently 5 institutions offering training in audiology. The institutions offer different qualifications that make one eligible for practicing audiology in South Africa. The qualifications are as follows: 1. B. Audiology. 2. Bachelor of Science Audiology. 3. Bachelor Communication Pathology, Audiology. And 4. B. Speech Language Pathology and Audiology. BSLP, PNA. All practicing audiologists are required to be registered with the Health Professional Council of South Africa, HPCSA.